The United States has suspended $21 million in funding for Kenya's health ministry. A statement from the U.S. Embassy in Nairobi said the freeze only represents a small portion of the overall U.S. investment in Kenya's health sector. Our correspondent Kevin McAleese reports.
The U.S. State Department said it took the measures in the wake of reports of corruption and poor accounting standards at the Kenyan Health Ministry. The suspension represents only 3.2% of health funding from Washington, which amounts to around $650 million a year, according to the US government. The action is intended to protect US taxpayer money and to make sure that the investment is reaching those people most in need. The statement adds that US officials are working with the Kenyan ministry on ways of raising standards in both the accounting process and those internal controls that were criticised. Treatment, prevention, emergency response and tackling HIV/AIDS, the US Embassy stressed, would not be impacted by the suspension, and that other life-saving and essential health services would also continue to flow directly to the Kenyans that need them. An earlier statement from USAID said the suspended funding covers salaries, wages and travel expenses at the ministry. No timeline was specified on when the freeze on that $21 million would be lifted, but the US Embassy in Kenya said it would be restored once progress had been made.
Well, there has been a response from the Kenyan government. The health ministry says that the corruption claims leading to the suspension of the US aid are under investigation. A press release from the ministry acknowledges that the Kenyan government and US authorities have been in touch over the issue, and appropriate action would follow the completion of those investigations by several independent agencies. The ministry also emphasized that the aid cuts would not affect the delivery of life-saving services.